Assalamu alaikum. I'm Dr. Rubina Hameed. I am a pediatrician. So that means that I work with children from birth to 18 years of age. Vaccine is important in children to prevent the acute illness. It is important to prevent them from having serious outcomes in some children, and those children who are may be affected of pre-existing conditions like the obesity, like children with Down syndrome, neurodegenerative disorders, autoimmune disorders, children on treatment with cancer, and those are, we need to look after those kids. And then the third important thing is to reduce the transmission in community, and then to keep the children in school, keep the children going to the extracurricular activities, not to isolate them from social and sports and school. I think this is why we think as pediatrician, vaccine is important for kids. I get asked this question a lot: is the vaccine safe? So this vaccine, which we have now, these vaccines were released in a matter of about 9 to 12 months. It is a relatively short time that these vaccines were released, but I think we have to be very confident, and I'm very confident, and our medical colleagues are very confident that no shortcuts were taken when these vaccines were produced, because all vaccines go through these three phases. The first phase is the safety phase, when the vaccine is tested. The second phase is the immune response phase, and the third phase is usually looking at it that it has providing enough protection to the individual. And the reason it is slow is because people don't have money, and because the governments don't have money, hospitals don't have money, and we produce these things really slowly, and research goes on and on. So when the pandemic hit, we had a sort of global collaboration of scientists, and a lot of money was put into it. So that is why we saw these thing going from one stage to the other, because there was money there were resources there were people there who were able to produce this vaccine. So this is why it was produced in a record time. After those three phases, it's also important to remember that when these vaccines are rolled out, we have a very robust regulatory programs to monitor the side effects. And I think people, again, get very nervous when the government or the authorities change the guidelines. That is because we are monitoring it so closely that if there are side effects, then the recommendations change. And this is why we feel so safe, because we have a real world data from UK, US, Canada, Israel, that millions and millions of children had been vaccinated, and they have been monitored for side effects, and we know that it is effective and it is safe. The best vaccine is whichever vaccine it is, more than 90% effective in the trials and in the children who had received it in US and UK. Similar to any other vaccine, you might have arms which is a little bit sore, headaches, muscle aches, fatigue. Some children feel tired after having the vaccine. In some children, nausea and drowsiness is also seen. Again, from world data, we know all children have recovered without long-term effects. Or we call it MIS-C because we can't say long words. MIS-C is easier for me. So it is one of those rare complications of coronavirus, which we have seen in age group between 6 and 11, who have had coronavirus about 4 to 5 weeks prior, and they may not have had a severe one. So they might just have a mild coronavirus illness, but then they have come to hospital with this multi-system disease, which means that it affects their heart, it affects their lungs, it affects their lymph nodes, and they have eyes affected. And so I think this is one of the reasons for encouraging people to take the vaccine, to prevent that serious illness. The current advice is that you can have it on the same day. So one of the things that I tell parents is it is important to talk to your children according to their age. We talk about the needle phobia with a child who have anxiety. We need to use the right words, use the right body language. Rather than calling it a needle, for instance, don't call it a needle, call it a vaccine. If you're trying to tell the child why they need it, it is trying to say that it's like a super shield. It's trying to protect them from bad virus.